Hi everyone, Dr. Mike here. Today we're going to talk a little bit about acute conditions versus chronic conditions. Acute conditions are basically new injuries where you sprain an ankle or you get a whiplash injury in a car or something that causes acute trauma to the ligaments and the joints and the muscles. When that happens, the first thing the body does is sends inflammation to the area. Inflammation is a key indicator of an acute condition. Severe inflammation. If you sprain an ankle or have ever sprained an ankle, you see it just swell up like a balloon. We can't see that in the spine too much, but it's happening. It's just deep inside of us and we can't see it. So a lot of times people don't think they're swollen when they really are. But a chronic condition is something that's been there for a while. Something you've had for 6 months, a year, 2 years, 10 years, 20 years, 30 years, 40 years. Chronic conditions are much, much more difficult to fix because they've been there for so long. They've had a chance for the body to lay down a tremendous amount of scar tissue. Scar tissue is difficult to break up. It is very fibrous in nature. It's not as elastic, has way more pain fibers than normal tissue does, and causes a lot of problems down the road. The body tends to overheal things. When you have an acute condition, that's why it sends so much swelling to the area, to try to stabilize the area as much as it can with scar tissue. So if we can break up that scar tissue early when it's an acute condition, we can avoid it turning into a chronic condition. And that's one of the key aspects I want to talk about. It's way easier to come in and get fixed up when you have an acute condition such as a whiplash injury or a sports injury of some sort or a sprained ankle than to say, oh, it'll heal up. You're right, it will. The body's really good about healing things. And like I said, it tends to overheal things, which causes way more problems down the road. Now it turns into a chronic condition where the joint isn't moving correctly. It's got a ton of scar tissue around the area. It's way more painful, way less flexible, and it starts to degenerate. Let's catch things when they're acute, guys. And don't expect chronic conditions to get better overnight. Don't come into my office with a 30-year-old back injury that just got flared up and you think I'm going to fix it in one day. It's not going to happen. I'm not magic. Nobody is. And no matter what, it takes time to heal chronic conditions because they've been there for so long. Heck, it takes time to heal acute conditions. What's it always take when you sprain an ankle or you break a bone? They always tell you 4 to 6 weeks. It's more like 6 to 8 weeks usually. And even with the 6 to 8 weeks, that's the first phase of healing, where there's 3 phases of healing that we're not going to go into right now. But it takes a long time even for an acute injury to heal. It takes way more time for a chronic injury to heal. So I hope this helps you understand a little bit better, guys. Get that ice pack out on those acute injuries and get into my office. I'll talk to you later.